At Consumer Reports, we've been rating cars, appliances, and electronics for over 75 years. And in 2008, we established the Consumer Reports Health Rating Center. So why do we need a health rating center?
Pharmaceutical companies spend billions of dollars on advertising, and hospitals and even doctors spend big money too. The Consumer Reports Health Rating Center cuts through the hype with accurate information without advertiser influence from a source you can trust.
Our mission is to rate hospitals, doctors, and health insurance plans. We also recommend drugs and treatment options, all with the scientific rigor and evidence-based methodology that Consumer Reports is known for.
Our first hospital rating story focused on preventing deadly infections, like the one Carol Bradley suffered following surgery. Her daughter sounded the alarm.
She saw me laying there looking dead.
And 2 years later, we expanded that coverage to determine how safe is your hospital. We analyzed data from nearly 1,200 hospitals in 44 states and gave each hospital a safety rating in several categories, including avoiding infections, readmissions after discharge, and the overuse of CAT scans. Nationwide, we found big differences.
The amount of accidental harm inflicted upon patients in some hospitals is epidemic, and in many cases, it's almost entirely avoidable.
We found big differences among doctors, too. We rated primary care physicians in several states. And in our story on the business of healing hearts, we rated hundreds of surgery groups that perform heart bypass operations. Joyce M. Sontag suffered a stroke during her bypass operation. She wishes she'd known more about her doctors.
I thought I was making a good choice, but it's true I didn't know all the statistics.
Our investigation showed that consumers don't have enough information about heart doctors. So we teamed with the Society of Thoracic Surgeons to make that information available.
Medication is another key focus. About half of all American adults take at least one prescription medication. But where do they get their information about all those drugs? Usually it's from the manufacturers themselves.
Taking Lipitor. Numbers don't lie. My cholesterol has stayed down.
On our Best Buy Drugs website, we provide an alternative.
What we do is we work with researchers who analyze hundreds of studies on common prescription drugs, and we bring you their findings in terms of the safest, most effective drugs for common conditions, such as diabetes and asthma and dozens of others.
And we focus on cost. Our research shows that paying for medical bills and medication is the top financial concern people face. And here's our latest effort. We've partnered with the American Board of Internal Medicine Foundation and other leading doctor societies to identify dozens of common medical tests and treatments that are often overused. Take EKGs. For people with symptoms of heart disease, they can be life-saving. But in low-risk patients, the tests are less accurate, and that can trigger follow-up tests that do pose risks. Our Choosing Wisely reports give Consumer Reports advice on alternative treatments and let patients know when tests are truly warranted. Our analysis gets a lot of attention.
We're proud of what we've accomplished with the Health Rating Center, but we have more work ahead to help consumers understand and compare their healthcare options, talk with their doctors, and make the best possible healthcare decisions.